again, everyone, Mark Hackle, Macomb County Executive, Deputy Executive John Paul Ray, just giving a quick update of what we're doing or what we're seeing with COVID here. We're hoping and waiting for more vaccine. That's the biggest concern. I mean, you do the numbers, a lot of people that are trying to get the vaccine, but very limited doses statewide, and new formulas that are kind of being tried and tested. Again, limited numbers here. So this week, we're looking at about 1,000 less, 1,025 less to be more precise, from what we had. So 6,250 are what's going to be available, but with that availability, we're still focusing on seniors, and we haven't finished with the congregative care. We've got some folks that we're still trying to take care of, and we're taking out of that allotment to go into those senior complexes right now.
Mark, about 5 dozen plus or minus congregative care sites that our health department and emergency management has stepped up and has been able to help out with. Those 1,000 less doses undoubtedly are going to create more demand and yield that we're not going to be able to fulfill this week. We've extended our conversations with the state of Michigan, not only illustrating our priority groups, how they fit into that social vulnerability index, how we're trying to illustrate that Macomb County has priority and population groups that are more vulnerable, whether it's the 152,000 seniors that we have, whether it's some of those areas where we talk about accessibility, whether it's there's transportation barriers, language barriers, socioeconomic issues. These are all the types of things that are going flying back and forth as far as variables that the state's looking at, but we're being as creative as possible to illustrate the need and the demand that continues to rise here in this county.
And that's a confusing issue.
Yeah.
We talk about these vulnerability index and what they're trying to figure out, with the state deciding what the allotments are. And simply put, we know population-wise, we are a large population base here in Macomb County. So that's part of the formula. The other is senior citizens. When they talk about the vulnerability, that is a large portion of what we've got here in Macomb County. Probably the largest percentage of our population with seniors is here in Macomb County as opposed to other counties. So with that being said, we should be ahead of the game when it comes to numbers of doses allotted to the county. But apparently they're adding these other dimensions or other economic factors and other demographics that they're throwing into it. We're really not sure exactly how it all fits in, because we do know this. The standards are, we need to figure out how we're dealing with people that are most impacted by the virus if they get, they catch it. And it says it's senior population. So again, you're going to hear me say this over and over again. I say it for this reason. We're fortunate. There are a lot of people here that I think aren't being too, upfront about saying, hey, I'm going to go ahead and call in or try to get online and get a scheduled appointment for myself. I'm going to think about a senior, and we're really pushing that with folks to kind of, not forget our seniors, don't leave them behind, because we're getting a lot of emails, a lot of outcry from seniors, and we're doing things internally to try to make sure our seniors are taken care of. One is those congregative care facilities where we're taking the allotments and going out there. That was part of 1A, and we're not even finished getting to those seniors right now. So we're going to be doing that. And we're working on a couple other areas right now, working with some other providers that might be helping us get into the communities to try to help deal with those seniors that can't quite get to the facility that we're looking to vaccinate people at right now. So we're working with some community partners and working on some partnerships. You're probably going to be hearing more about that at the end of the week. But again, it's still limited doses. It's not a panacea. It's not going to solve the problem. Until we get more doses and other areas get the doses too, like the folks that are at the pharmacies, the folks that are at these urgent cares, the doctor's offices, like you would see with a normal flu vaccine, it's going to be a continued process of people trying to figure out what list can they get on. Who do I need to call? How do I do that Tuesday mad rush to try to get through on a phone line or on a website? Everybody's got different things going on statewide. That's a problem. And I'm just going to tell you, the 211 thing, that probably wasn't a good idea. 211 isn't designed to figure out how do they take appointments, and they're not taking appointments. So again, you can still go ahead and try to call it if you want. We suggest not, because that's not something they're readily available to handle right now. But somehow that got out that 211 is a proper thing. It's like 911. You don't call 911 to set up an appointment. That's not what they're doing. There are various outlets, hospitals right now, health department, and maybe some of the pharmacies that might be able to do that for you. But again, we're all struggling with the same problem. We're not getting enough vaccines to solve this problem.
Mark, it's interesting because as we have a multitude of conversations throughout the week with regards to our vaccination strategy, we bring in a tremendous amount of creativity. We bring in a tremendous amount of inventiveness. We bring in the partners looking at the global perspective of how it impacts our community. But again, what it boils down to is the supply deficiencies.
That's it.
All of this goes back to that foundational issue, which any multitude of information that you might see on cable news or any multitude of information that you might hear from, another talking head that may be spouting something on the radio, or you may look at a blog or something like that. Yes, well, that's part of the entire conversation. The matter of fact is we got 1,000 less doses than we did last week. That hurts.
Right.
But we're still going to make sure that we're transparent about it. We're still going to make sure that we get it out in the most appropriate and equitable way possible. And we're going to still make sure that everyone that comes to the VERC site to get a vaccination is met with professionalism and respect.
And they do. And again, I go back to the vulnerability index that they're talking about here. With various categories they work into this. I can't help but question, what is it that really is driving that? And for the reasons that other areas are getting more than we do here. Sometimes saying it is given an impression that we're complaining about somebody getting more than us. That's not the issue. We're asking questions because, quite honestly, when you think about or talk about the data, the science, statistics, the numbers, no question it should be going to seniors who are the most vulnerable. But if you're going to say, well, we're getting more in certain areas because of other factors that don't deal with whoever gets sick is the one that's going to be most susceptible, then you need to be making sure that those allotments you're getting are going to those target groups. That's not happening. I mean, we're probably the only county right now that says, hey, it's open, fair, and equitable to everyone, yet we're trying to do things kind of behind the scenes to work on our seniors to make sure they are getting taken care of and not being left out. But we're hearing others are vaccinating, they're letting people step to the front of the line that are county commissioners, that are state representatives, that are public or elected officials. Inappropriate at best, unless they happen to fit in one of those categories. So here in Macomb County, we have not changed that mindset from day one. It's, unfortunately, the floodgates open as far as demand. Put seniors in a very challenging position to have to compete, but we're certainly not going to say to the seniors, you're sitting back while we're vaccinating these classes of people or people that are public officials or elected officials. They're not going to the front of the line here in Macomb County. They haven't from day one and they won't. So everybody's going to have to go through the same process, although believe me, we get a lot of pressure to try to figure out how do we solve their problems and make it more accessible for other target groups. Our target groups here in Macomb County that we're laser focused on is trying to figure out how do we deal with our seniors, 75 and older and 65 with an underlying health issue. And those are the ones I think we should just allot all the vaccines towards right now so that we take care of that first. But I can't do that according to state standards.
And Mark, we're still having the evolving conversations with our healthcare systems. Obviously, they're doing, a multitude of different options with regards to serving the priority groups, but also giving some of those preferences to those that are in their healthcare system, whether you're on a MyChart using a digital app, have a physician that's put you on a list and stuff like that. And again, those are different avenues and outlets where individuals the public can assess and examine if they're eligible through those systems. But again, adds a bit of murkiness because, okay, we hear that seniors are over here, but teachers might be over here, and then these workers might be over here, but then we've heard that there's 200 doses that might be at a pharmacy over here. Those are all one-offs. Those are all anomalies. That's not the systematic type of response that we're looking at. And as you said, that's not the clarity that we want to ensure that we can get to the public.
And you hit it head on. I mean, that's spot on when you're talking about that. Right now, there is no organized way of dealing with this statewide. I say that because phase 1A there was no question about it. When the state allotted their allotment to the hospital's responsibility was to take care of those that are in the healthcare field. That was their job. When they allotted them to the pharmacies, they said, you need to go to the congregative care facilities and work with those senior complexes and figure out whether you can get agreements to vaccinate the folks that are either clients and or people that are working in those facilities. And then they gave them to the health department statewide and said, your job is to deal with those that are basically licensed EMTs and to take care of them. That's what we were working on, and that's what we're doing. Everybody understood their role. But right now that's not happening. When they opened it up to this 1B and partially 1C, what they did was they said, here, hospitals, you get it. We know you're done with your healthcare workers. And pretty much decide what you want to do with those doses. If you want to go through the MyChart systems or people that are part of your system or do teachers. For us, we just said, if you're giving them to us, we're going to do what you asked us to do. And that's allow people that are still part of 1A and those that are part of 1B and allow everybody that fair and equal access. We can't just go picking and choosing folks to kind of do something special for because it irates different groups or segments. So again, we're going to focus on our seniors with the allotment we got, but I can't control what's going on in these other facilities. I wish they would just allot them all to the county, and we can then once again figure out if we want to target a special thing for teachers, a special thing for public safety or municipal employees, and obviously a good portion of that would be focused specifically on our seniors. But you got everybody else kind of going off in different directions. We don't know what it is. In fact, our allotment this week went down because they went more to the hospitals. And we don't know how they're handling it. We call them and talk to them, but they're all over the map. Everybody's got their own system, and I can't control that. I can't stop them from doing what it is they're doing because the state's allowing to go ahead and take those vaccines and just make sure they're taking care of target groups in 1A and 1B.
Mark, I think one thing that's imperative to reiterate as we've updated individuals in and out, every single dose that the county gets will be accounted for tomorrow morning. When we open up the phone lines, when we open up the appointment portal, that is our #1 priority every single week, and we'll continue to do that in the most equitable, transparent, and efficient way possible. But as you said on the back end, that's where we're going to continue to ensure we're pulling the levers, connecting with our partners, and getting the right resources that we need directly to the community.
We're going to continue to do that. So again, today happens to be on, I guess, the day after the Super Bowl, something I'm a big fan of. I love watching the game, and again, I'm just going to say it, the team I was hoping would win won. I'm a big Tom Brady fan to begin with, and Gronkowski, so we were kind of helpful with that. But as always, I'm looking at the commercials, and I find it interesting when you look at those commercials. The one that I noticed that kind of stood out, and there were a couple of them that kept talking about it. They were really promoting, even on the national scale, the shop local, as well as eating from these restaurants, or at least supporting our restaurants. So I was kind of surprised by that. But there were at least 2 commercials out there that kept telling people that hey, don't leave our businesses behind. They've been struggling. They've been challenged. Right now, many of them are open again, with certain restrictions or constraints, on behalf of the Department of Health and Human Services. We're continuing to work with them. But again, we can't overemphasize that enough. Please help your local retailers, shopping local, as well as obviously the restaurants that are out there right now that are struggling. If you can, even if you're still uncomfortable about going and dining in, order out, order that carry out. But again, our planning department has been working very closely with them. And I was just surprised to see that, those commercials actually on the Super Bowl network there. I thought it was kind of neat.
It's a fantastic message. It's been one of the things where we've really focused on how those local actions can have a more global impact and everything. And I think those commercials yesterday were a testament to that. And as you said, Mark, it's definitely a great opportunity to re-engage those local businesses in your community, spend a couple bucks, and make sure that we're supporting those that are around our neighbors.
I think what JP was saying is they were following our lead.
Yeah, they could have been.
It's interesting. I mean,
they've got us bugged.
We're following what we're doing here in Macomb County and have been doing since day one. So on that note, again, we're out there making sure that we try to get as much vaccine as we can to the public. We only give them what we get, and we're going to continue to make sure that we haven't had one miscue where a allotted vaccine has gone to waste. We're finding ways to make sure everybody gets it if it's opened up, and we're trying to take care of it. We're reaching out to the communities, working on some partnerships. Again, I'm asking for 50,000 a week, and we can handle 50,000 a week. But now getting just 5,250, that really is a challenge. And people are, once again, going to be calling them out, being frustrated, and people are going to go ahead and try to log in and become frustrated. It's just the way that the system has been set up or designed because of the lack of vaccines. So in the meantime, we want to continue to remind you to keep you and your family safe.